I'm going to take you through this session around health literacy. Really looking forward to it, and I hope you'll see some of the passion I've got for this subject come through. I'm going to start with a quote. The exciting thing about health literacy is that we can do something about it now. I think when it comes to health inequalities sometimes, or promoting health equity, it can be quite daunting. And to me, it's generally one of the things, health literacy, I think it's something we can do something about relatively quickly, relatively easily, and I think it makes a big difference. And we'll come back to that and see if you're equally as excited as I am by the end of this session. So what we're going to go through is some very quick introductions. Don't worry, we're not going to get 100 and so many people come off mute and do introductions. We're going to do stuff in the chat. I'm aware that some people will have a great knowledge of health literacy. I guess I'm going to be really honest, I'm still quite surprised when I go around various places how little is known about this subject. So I will do a quick recap on what it is and then why it's important. And right at the heart of this is what might it feel like to have lower levels of health literacy? We've all got different levels of health literacy. We've all got health literacy, but to different degrees. So let's just explore that, and I'll take you on a slight tangent to do that. And then I'll share what you could do. And I'm going to be joined, delighted to be joined for that session now. I've got a good friend, Paul Iggledern, who's a public health consultant down in Dorset, who's been doing a lot of this work. So he's going to say a little bit about what's happening across the health and care system in Dorset. And then leave a little space for questions. If we don't get to your questions today because of time, you'll be able to get my contact details, so please get in touch if you've got any other follow-on questions. We were planning to record it up until the questions. I'm not sure if that's working or not, and we will share the slides. They will go up on the CHAD website. So just a quick intro. I came through the University of Staffordshire on my journey to becoming a health psychologist, and I picked up my health literacy experience whilst working for the public health team in Stoke-on-Trent. At the time, Stoke was a real hotbed of health literacy. So very, very lucky to have been working there and picked up some of the responsibility for this work. And as a result of that, I'm a member of Health Literacy UK, a board member, which is an organisation dedicated to promoting the good subject. And I do a lot of work under my own steam, helping health and care organisations become more health literate. And that's a collection of logos for you. This is just a sample of the places where I happen to have done some work. These are not the only places where great health literacy work's going on. I'm very aware there's some amazing work going on up in the northeast with Ryan Swires and other colleagues there. They're having a great focus. I know there's other great stuff going on in places like Herefordshire and Worcestershire. So I think things are happening. The reason I share some of those places is so that you can see, yes, some of these are trusts, some of these are local authorities, and they're not always directly health services. The work in Staffordshire was with the libraries, and there's third sector and community groups as well. So this subject applies wherever we are liaising with the public about health and well-being in its broadest sense. So just to get an indication of who is here, could I trouble you to go to the chat and just put in those key things there? So what's your role, and which members of the public do you or your team or your service organisation interact with the most? So it's just really interesting. It's nice to be nosy. Who have we got? What's your role? But who are you interacting with from the public? So over to you in the chat for a few minutes. So thanks for getting us going. Always like to see who's got the fastest fingers here, because you'd be my pick for Who Wants to Be a Millionaire. So we've got kind of some quite broad groups there. So we've got young people, we've got people in communities, just communities in general. So you can see the general pattern, as ever with these things, is if you've got a role in health and you ask the question, so who do you interact with? It's kind of like people, and therefore health literacy is relevant to just about any role in health and care. And hopefully you'll get to see why. So thank you for doing that. So what is health literacy? I'm going to start with a definition. And you'll notice in the background there's a coin. So the language I use around this is two sides of the same coin. Quite often when people describe health literacy, they'll start with the people side of the coin, and we'll talk about people's ability. Reading age comes up. It's about whether people can find information, understand it, and then act on it. And I'm really pleased personally that health literacy has been on a bit of a journey, because quite often it was just a description of people's abilities or inabilities. So I felt it was always a bit blamey in terms of some of the initial focus, but naturally and gradually it's matured into recognizing that we as providers have got a part to play. So that's where this two sides of the coin comes in. So today the main focus is on organizational health literacy, but it's always in tandem with personal health literacy. So organizational health literacy is about how do we as providers make it easy for people, which is why I quite like this definition from Helen Osborne, who's an absolute leader in this field. Health literacy is about communicating health information in ways that others can understand. I really like that definition. So why is it important? So what I'm hoping is, obviously the sort of the background to all these webinars we do is around health inequalities or promoting health equity. So I know many of you know a lot about that subject. So sort of think about that concept as we're going through this. So if we, going back to that definition, if we do communicate health information in ways that others can understand, we will help people to attend appointments, right time, right place, and prepared for the appointment. Will help people to navigate health services, whether that's online or actually in person, engage with disease prevention, avoid unhealthier behaviours, or hopefully adopt more healthy behaviours by making it easy for people to understand. Will help people understand when they need and help with health, and communicate better with health when conversations are happening. So again, I'm using the word conversations very intentionally there. Health literacy is about verbal communication. It's about written communication. It's about this environment that we provide for people. So we saw the wonderful variety of roles that you've all got. So some of these will be more relevant to you than others, but wouldn't it be good if we could make the world a slightly better place by helping people this way? So on the people side of the coin, again, think health inequalities here. Lower levels of health literacy are associated with, and I'm not going to read out that full list. It's not a particularly cheerful list. Increased risk of morbidity. So people with lower levels of health literacy are likely to be iller. And then the really miserable one, premature death, likely to die earlier as well. So again, you may have different priorities in the services that you're delivering, but you can see there that there are challenges there. And then some of the research that's really well known particularly by Professor Jill Rowlands, Joe Prothero, who are absolute leaders in this field. A lot of people find it hard to understand written health information. And when we throw numbers into health information, people find it even harder. And numbers are everywhere in health. If you just think about, in fact, I'm just going to ask you again, can you just go to the chat again? I'm just going to ask this. In some of the services that you provide, Where and when do you use numbers? So just, if you could just go to the chat, just tell me, where and when do you use numbers? Any numbers? So yeah, thanks for getting us going there. So evaluations. So we've got a couple already on our alcohol there. There's data and evidence. Yeah, numbers are absolutely everywhere in health. So reports that go out to the public. So numbers are everywhere. Yeah, there's some very, very obvious clinical ones around, blood measurements, BPR, some of the KPIs, they're absolutely everywhere. So health, there are numbers in temperature. So what's the right temperature to have a warm house? Is that in Fahrenheit? Is it in centigrade? There's numbers that are in food labeling. So yes, there's always clinical information, but health, is, as you all know, is so much broader than that. So we do include numbers, and that's as simple as kind of things like appointment times, bus timetables as well. Couple of other stats there. Lots of people, lots of adults don't have the highest reading age, but hey, guess what? We as the health and care system quite often put out information that has a very high reading age. So there's a real mismatch. People are aware of this, but it doesn't always happen. So the government, some of the government teams do know we should be writing at a certain level, doesn't always guarantee that it happens. So this was some work that was done in Stoke a little while ago now, but again, think of the mapping to health inequalities. We did a really big piece of research across the city, and we found there was a correlation between people with lower levels of health literacy, and you can see there on the right, we like to be older, like to be a bit more poorly, etc. So more likely to be on their own, which is a real interesting dynamic. It's hard to build up your own confidence in health literacy if you're on your own, if you've got no one to go home to and have a conversation with about your health and well-being needs. So you can see there's a kind of a very strong correlation. I was fortunate enough, it was only last week, there was an amazing conference around head and neck cancer. Again, a subject I wasn't particularly, I'm not an expert in head and neck cancer, but they were having a discussion around health inequalities. So there's people living in the most deprived areas, almost double the rate of head and neck cancer. So again, not particularly cheerful. Later diagnosis. So an argument for making things easier for people to understand preventative behaviours, spot signs, have more confident conversations with practitioners. So it's kind of relevant everywhere, and obviously they've done a little bit of work into this as well. Part of the reasons behind this, never the only reason, part of the reason behind this is lower health literacy. There is a tool out there which is quite interesting, quite useful. If you have to think about your area that you work in, it's freely available. So you'll get a copy of these slides afterward. We'll put them up on the CHAD website. It's called the Health Literacy Geodata Tool, and it basically plots out in England. I'm afraid it's only England, so apologies if we have any colleagues from other countries. It plots out by local authority area what the health literacy levels are. And guess what? It maps quite strongly to areas of social and economic deprivation or prosperity. So, and I just chose some areas across the country using my O-level geography. Yes, I did O-levels. So I just picked some places from different parts in the country. So the southwest, kind of just Surrey Heath, so it's kind of like in and around London, home counties, Ipswich. You can see there the different areas. It's quite a useful tool to tell the story in your area. And then I just thought it was quite interesting to pick up. I remember there's some really, really useful graphic from the King's Fund. They've got a great publication on health inequalities. So we kind of put the two side by sides. We've got lower levels of health literacy, which are the dark colours. The green on the King's Fund one, basically the lighter green is lower life expectancy, darker green, higher life expectancy. And as they say, life expectancy is a key measure of a population's health status. Inequality in life expectancy is therefore one of the foremost measures of health inequality. And I did a little bit of quite reasonably unscientific mapping, and there's very strong overlay between the two things there. So I think there's quite a strong correlation there. So hopefully that's building up a bit of what it is and its relevance to health inequalities. But one of the other things I really noticed over the years of doing this is sometimes it's hard to imagine what it feels like to have lower levels of health literacy. If you happen to be very fortunate in life, if you've got the confidence and the cognitive skills to be highly health literate, and I generally think that's part of the problem. We've got a lot of people in the health and care system who are trained to be smart, and thank goodness, trained in a certain way to write and be rewarded to write and speak in a certain way. And part of the problem is that doesn't match always with the population. So I always do this thing around what's it feel like. So I'm just going to share a little story here. So there's a prize, and there's a prize on offer. If anybody can recognize that, it's one of personal, this is where I go on holiday quite a lot. If anybody recognizes that, you can have an extra week's annual leave. Does anybody recognize where that beautiful little place is? If anybody does, that'd be absolutely wonderful. So just type away if you think you know where it is. It's a place called Stackpole Quay. It's in Pembrokeshire. And it's a place where me and my wife go on holiday quite a lot. My wife's family are originally from Pembrokeshire, so it's been a bit of a family pilgrimage over the years. And I've got to fall in love with the place. And what we particularly like doing is going self-catering, as near to the sea as possible. Now, one of the things I've noticed is when you end up in someone else's house, whether it's an Airbnb or you're renting a holiday property in a different part of the country, you have to deal with the recycling. And I'm going to be really honest, I hate that. I'm absolutely shocking when it comes to that. I like to recycle and I want to recycle, but I get quite confused by some of the what you're supposed to do at home, but also when you go somewhere else and the bins are a different colour and the days of the week are a different colour and they've actually got different rules. So I think it's a great example that's away from the world of health that illustrates this point quite nicely. So what I'm going to ask you to do is, again, just go to the chat if you could, and can you just type in some of the words and phrases that are associated with recycling that perhaps confuse you. So I'm just going to leave you for a minute or so. Just go to the chat. What are some of those things you have to do? What are some of the instructions, or what are some of the words? Yeah, so plastic. Yeah, what do you do with the plastic? What can, what can't be? Absolutely. It's different in different areas of the country. Yes, somebody's put there. There is some research into this. There are at least 149 different regimes across the country to deal with recycling. Oh, somebody's put some acronyms in there. Oh, and we'll come back to that one. Recycle at large supermarket, ? So now some of you will be very confident about recycling. You're thinking, what's all this about? Others, as you're seeing here, and confusing images as well. Yeah. Does magazine paper count as paper? We'll leave that one hanging there. If anyone can come back in on that one, that'd be great. Oh, I was with a local authority a couple of weeks ago, and there was a heated debate amongst some very senior people about whether, if you wash your tin of baked beans, do you wash it out? What happens if you leave one baked bean in? Does it make it through the recycling process? So we've got some of those. So thank you for typing it in there. These are just some of the words that come up. I discovered the word caddy the other day. Apparently, I've got one, a compost caddy. It's where you put your vegetable waste near your sink if you've got one. I didn't actually know it was called a caddy until the other day. And this is my favourite one, wish cycling. Yes, wish cycling is a word. Wish cycling is the act of putting something in a recycling bin and just hoping that it will get recycled. And a lot of people do that. So there's a lot of anxiety, confusion around the language and the behaviour, and that's key. So a few of you mentioned images. Images are relevant to health literacy. So we've got, I'm sure you may feel confident with that one and that one. Rinse and recycle. Somebody put this in the chat. Recycle with bags at large supermarkets. So again, I've been learning when I've been exploring this subject. There are some things that you can't recycle at home, but if you take them to a supermarket, there are special places. Now, I know some of you will know that, some of you won't. And then there's some other great ones where you need to put a hat on to recycle that kind of bottle. You need to take your sleeves off to recycle something else. So there are all sorts of confusion around images and images, posters, signage, very relevant for health literacy. So behaviours are key. So what happens, some great research come out of Manchester Uni on this. So some people are trying it, get it right. Some people try, get it partially right. Some people try and get it wrong and give up. So think, you can see where I'm going with this, the parallels to health instruction, health information. Some people get creative, and by creative, one example of that is some people who want to recycle, they can't recycle that thing in their local authority area. They will drive to a neighbouring local authority area to recycle. So again, think of the kind of implications of that. What a strange behaviour that's caused. Some people just take one look and give up. Some people would like to do things right, but don't know who to ask, how to ask, or don't have the confidence to ask. Very relevant to health literacy. And then some people seek information online. So this happens to be from as I mentioned, Pembrokeshire was this holiday destination. When we got to one of the last places, we were presented with what felt like quite a complicated system, which we learned was a stackable trolley box, no less. And because I was resourceful, I googled what on earth is a stackable trolley box, and I'm sure you'll all be delighted to know that it's a multi-box recycling container that assembles neatly into one easily maneuverable unit, enabling multiple material streams to be collected at once. So that cleared that up for me. So some of this will make sense to you, and it is quite logical, but it's confusing, and it puts a barrier in place. So why don't we make things easy? So what you can do, and this is a very tangible thing you can do around health literacy. It's not the only answer, it's part of it. You can work out what the reading age of documents is, and I know some of you will be doing this already. There's an NHS medical document readability tool, freely available. It's just out there on the internet, and you can plug in text. It works like many of the readability tools. And guess what? That text around the stackable box that I'd got was age of 17, a reading age of 17. So again, if we know that the reading ages of a lot of people in the country are a lot lower than that, we've got this mismatch. So you might want to reflect. It may be recycling for you. It certainly is for me. I'm as certain as I can be that pretty much everyone has got situations in life where they feel uncomfortable. So you might want to reflect on that. What is it for you? Quite often when I ask this question, it's kind of having to talk to a solicitor, ringing up, or have about phone insurance, having a tradesperson come round to your house, fixing your boiler perhaps, or to do a bit of wiring. If we feel like that in those situations, how might people feel when they're faced with health information and having to make health decisions? So I think this is right at the heart of health literacy. So just going to sort of move us on a little bit now. So if we do, coming back to this definition, if we do communicate health information in ways that others can understand, then to me, this is why we're doing it. It's improved health outcomes for people. There are, we need to recognize this, there are priorities for health and care providers. So in terms of the context for today, obviously promoting health equity, tackling health inequalities. If we get things easier, make things easier for people, we're going to be more efficient and effective. It's going to help with waiting lists. It will contribute to reduce DNAs. We can't say it's going to fix everything. So sorry, DNAs did not attends. So if we make letters clearer about how to be somewhere, right time, right place, prepared for the appointment, that will help. It underpins personalised care. And as we saw earlier, if these things are important, it's going to play a part. So I'm not going to go through all of these. There is a document, I'm pretty certain we can put it on the CHAD website, along with the NHS last year. I wrote a paper, a document explaining how health literacy can contribute to some of these priorities. So again, there may be some of you on this session today who have those as priorities. So we'll get that document to you. So what can be done? So I'm deliberately still focusing on the organisational side of the coin. This goes back to some wonderful work by Cindy Brack and her colleagues. It comes out of the States, and the seminal work was the 10 attributes of a health literate organisation. I'm not going to read them all out in detail, but number one, and from my personal experience of doing this the last few years, there's a reason why it's number one, has leadership that makes health literacy integral to its mission, structure and operations. So without senior level buy-in, it becomes potentially just another initiative. It needs to be embedded into policy, a priority, people given time to do it. It's not just a one-off activity. So you can see there, prepares the workforce, etc. This list, there were 10, it's slightly American focused, quite understandably. So there was quite a bit in there about kind of how the healthcare system in America is paid for, slightly less relevant to the UK, but the principles across it was superb. And that's what I've become familiar with over here, helping organisations or teams, departments and organisations. So focus on leadership, emphasising the importance of co-production. Yes, helping staff become more aware of this subject, and very specifically then providing with skills around how to write kindly and how to speak in a health literate way, and where appropriate, the physical layout. So these are just some of the places I've done it. And one of those is Dorset. So I mentioned earlier that we've done some work across Dorset. So Paul, are you there?
Yes, I am, Mike. Hello.
May I introduce Paul to you? Paul's public health consultant down in Dorset, who's been on a bit of a health literacy journey for the last couple of years. Paul, over to you for a few minutes. Do you want to say what you've been doing?
Yeah, hi. Good afternoon, everyone. So we have been working around on the health literacy agenda for a couple of years in Dorset. That very much started or kind of came out of some work we were doing around health inequalities. As we came out of COVID, I was invited to work with one of the chief execs in the ICB area to develop a health inequalities program. Early doors in that, during 2022, we ran a series of webinars to help try and raise awareness around health inequalities, what they look like locally and underpins them, what drives them. And early on, I think we were very clear on the idea that we needed to support providers, colleagues, trusts, to begin to make some sort of cultural shifts, changes. And we kind of coined this slight play on Marmot notion of proportionate adjustments. And the health literacy sits very much in that space. We were concerned about how we could, as organisations / across the system, what role there might be for supporting staff to really kind of see the person in front of them and to kind of make those proportionate adjustments so that folk can understand and act on health information. So our journey, I guess, started with the programme of webinars in 2022. One of which Mike was invited to do a slot for us, a virtual webinar. And we then invited Mike to join us for a health inequality symposium that we ran in February 2023. And I love that word, symposium. My mum was very proud of me when she knew I helped organise a symposium. And Mike came down and did a workshop session for us at that symposium. And we had quite a central focus on that day at actions that people were going to take as a result of coming to the symposium, actions for themselves, their team, their organisation. And we invited people to fill in pledge cards and then collected them at the end. We had about 100 people in attendance on that day. Roughly half of them handed in pledge cards, and the standout thing that people wanted by way of support was support training around health literacy. So we got a small amount of funding out of the ICS Health Inequalities allocation and ran with developing this health literacy programme for Dorset. Really 5 kind of pillars to that. Well done, Mike, thank you. Which are summarised in this slide. We've been running awareness raising training, then a more in-depth champions training, the health literate organisational workshop. Alongside that, for people that have done the in-depth training, the champions, I've been hosting a community of practice, meeting roughly monthly to support colleagues on their journeys. And then in a virtual space, we've created a repository of materials for people, and we've been drawing on Mike's expertise. Over the last couple of years or so, I guess we've been working on this. We've begun to sort of, I guess, try and consciously create a bit of a shift, relying less on Mike for the awareness raising training and some of us as champions in the system delivering the awareness raising sessions to our colleagues. And that's allowed us really to up our reach. At last count, we've done something in excess of 400 people have attended awareness raising sessions, and we've got a pool of about 60 champions. And just to bring us bang up to date, where have we got to? We brought our champions together earlier this month, was it? Last week before, for a celebration event. So to kind of mark the progress that people have made, we invited champions to come back together at an in-person event. We had about 60 people in attendance. They were a mix of champions, about 20 of us, plus champions invited to bring guests. And we again had another session with Mike to help engage us with those guests and sort of maximise the opportunity there. And we had the notion there of bringing the champions together and sharing almost like a conference poster session or capturing the work that people have been doing to date. And just a brief flavour of that to finish up from me. We had 9-10 posters. We've got a number of partner organisations that have really picked up and run with the agenda, have developed policies and procedures. One of those is one of our community voluntary sector infrastructure organisations, Community Action Network, BCP. Another is the network, the Wessex Cancer Alliance, and our physical activity partner, Active Dorset, have all developed a kind of organisational policy approach to try and embed health literacy. And beyond that, we have a number of health provider organisations whose staff have come through into the training, and we had a very encouraging, uplifting suite of examples where people had done work on leaflets and letter invites, etc., and had really gone to town with trying to redevelop those. In some cases, going that extra mile to do co-production and really getting a product that kind of lands better with the audience. Mike, that's my whistle-stop tour through what we've done in Dorset, and I'll come offline, but hang around later in case there's any questions I can pick up on for people.
Thank you so much, Paul. Thank you very much indeed, Paul. I think we all love a symposium. So just to kind of move towards the end, leave a bit of space for questions. When we're talking about doing something tangible, I think there's a principle which is putting ourselves into the shoes of the people that we're writing information for, or even better, co-production, getting help from the people who are going to receive the information. So I've done some work up in Manchester, so in the trust there. So it's just one example, rather than being faced with the wall of text, or what is almost always a stressful time, whatever the subject, can we use some images? Can we just make things more, I keep using this, but can we just be kinder to people with how we share information? There's a complaints team at many organisations, and this is one of my favourite quotes. You never receive a complaint about a letter that's too easy to read. A lot of organisations pay people to deal with complaints. So let's cut out the complaints at source by making things kinder and easier for people. And again, another principle, if a reader overlooks information that we think is important and fails to act on it, whose fault is that? It's not the readers. We as writers have failed. And then in verbal communication, again, we don't have time today to go into this in detail, but there is a technique within health literacy. It's called teach back. I guess it's one of the flagship techniques. It's a way of, in an empathetic way, hearing back from the person you've been talking to what they've heard and what they're going to do. You'll find a way to do it in a caring way. You hear back so that then you think, yeah, they're going to do the right thing, or no, they haven't quite got it right. So it's your opportunity to play back to them and revisit the conversation to make sure that they go out of that appointment, that interaction, being able to do the best thing for their health. So this is a bit of a shift. It's a change for professionals. It's saying, I'd like to make sure that I've explained it. Okay, can you tell me what it is that we've discussed and what you're going to do? How are you going to explain this when you get home, if there is somebody to share with at home? It's a lovely way of reassuring yourself that you've done a good job. Of all the bits in health literacy, it's the one that's been researched the most. There's so much compelling evidence to show it helps with adherence to whatever it is you've been discussing. And on that basis, again, you can see I kind of like a quote that underlines these things. It's relevant just about every time you open your mouth. So just to kind of to finish, hopefully this has given you a flavour of what it is, the importance of the two sides of the coin, but that you can do stuff and you can do practical things. It's not rocket science. The only thing I think that's hard about it is that it's change, and we're asking people to change, and when we're busy, and that's hard. But if we do, as perhaps leaders in the healthcare system, know more about this, or if we are influential, how can we help all our colleagues and our organisations get up this kind of curve, rather than just hearing about this, but actually start doing things? So that's kind of leads us around to the quote I came in on, which is, I think there's something exciting. I think we can do something about this now. So I'm going to pause there. So this is the time for questions. I'll turn the slides off in a minute. There are some contact details there. So put Paul's name there. And you've got my contact details there as well. So
yeah,
Vicky.
yeah, so we've had